Frustrating for many people in Connecticut. Obviously, testing continues to be an issue, but right now it can be confusing on when you should take it upon yourself to be tested, especially with COVID so widespread and protocols changing with ups and downs of this pandemic. Joining us this afternoon, Dr. Syed Hussain, the Chief Clinical Officer for Trinity Health of New England. Thank you so much for joining us once again.
Thank you for having me. Good evening.
All right, so there are a range of symptoms for COVID. You could have a fever, you could have a cough, you could have sore throat, you could have just one of those things, a bad upset stomach. These days, what are you recommending for someone if they're sick?
So folks should keep in mind that they should have a very low threshold for getting tested. So the symptoms that you mentioned, in addition to loss of taste, smell, nausea, vomiting, diarrhea, sore throat, flu-like symptoms should then trigger a need for a test. You have two options. One is a PCR test that is sent to the lab. Those can take 1 to 3 days. There are longer lines right now at test centers because our positivity rate in the region across the nation is pretty high. And then there's rapid at-home testing. So if you're able to get those tests, you can administer them. If you're positive, you isolate for 5 days, you get in touch with your doctor, set up a virtual care appointment. But those are some of the steps you need to take.
We know that cold and flu season is upon us. If you have just a nasal drip, for example, should you get tested?
If this is unusual, if this is not part of your regular allergy profile, if this is something new, and if you think you've been exposed to someone who tested positive recently for COVID-19, absolutely yes.
And would you say that the rapid at-home test that people are getting, I mean, they're similar, if not the same, as the rapid test that you get at a testing site, correct? What would you say in terms of their reliability?
So there have been reports about these rapid tests being a little less reliable for this particular variant, the Omicron variant. Nonetheless, if you're symptomatic, then the probability that it will return back as a true positive goes up, as opposed to if you're asymptomatic and get tested. If you develop symptoms, you take a rapid at-home test, it comes back negative, but the symptoms persist, then what I would advise is two things. One, talk to your doctor, set up a virtual care appointment. And second, if it's been 24 hours, you can get another rapid test that increases accuracy of that test.
That makes sense. So I think it's like 1 in 10 were coming back with inaccurate results, and then you just increase that if you do 2 tests, right? You have less of a possibility if you get the same result. Okay, so this is interesting. I was looking at the state data, and here in Connecticut right now, as of Thursday, the state just sent out the new data, and I haven't been able to look at it because we've been doing the show. But as of Thursday, there were more than 15,000 Delta cases and only a little over 200 Omicron cases. So that would indicate that the surge we're seeing right now is actually Delta. What's your take on that? Is there some inefficiencies with the testing of the Delta and the Omicron, or is this Delta right now that we're seeing?
So it looks like Omicron is on track to becoming the more dominant strain in this country. I wouldn't want folks to get bogged down with which strain we're seeing, because not all tests that come back positive are sent to a specific special lab to get genotypic testing done and to figure out which type of variant it is. Bottom line for folks, as we get through these difficult few weeks ahead of us, is you need to stick to public health measures, and masking is extremely important in an indoor setting, especially now during winter. And second, if you haven't been vaccinated, this is the time to get those shots. And if you're eligible for a booster, please get your booster dose.
All right. Dr. Syed Hussain, thank you so much for your expertise as always.
Thank you very much.